We're going to go ahead and get started. And I am so excited to
That's good.
introduce our guest today. And this is Dr. Bryan Stepenanko, or Dr. Step, as he likes to be called. And he's an Army family physician and ambassador for what is known as the Institute for Muscle Centric Medicine, with a lot of you might be familiar with Dr. Gabrielle Lyon. That's really freaking cool. He's also received training from the Institute for Functional Medicine. He is training staff in the Army's first, am I right? It's the first and only functional medicine curriculum.
Yep. Spot
That's
on.
super cool.
Yes.
And then he lectures internationally, does a lot of work with the military, obviously. So we're so thankful that he's spending this time with us today, because I know he has a really crammed calendar. So Dr. Step, thank you so much for being here today.
Hey, thanks for having me, Paul. I'm excited to spend some time with your community members and just share some of my experience and wisdom. Hopefully it'll be helpful to everybody.
Oh, I'm sure it will be. Yeah. So if we had to clarify the intention behind this, that's exactly it. I reached out to you because I heard a lot of great things from people that work in Dr. Lyon's office. Said that you're just top notch, you're on it, and we want to gain from your wisdom. A lot of people have heard the term functional medicine. They get snippets of it in the holistic and ancestral health realm. We definitely mention it a lot. So really just to gain some insights from your wisdom and see what we can pull out of it that can benefit the people that are listening to it.
Definitely. And just to clarify kind of current life context for me, I'm transitioning out of active duty military status, joining the reserves. So essentially that means my day job as a civilian will be focusing on lifestyle and performance medicine, muscle centric medicine, and figuring out how I can leverage my functional medicine and even military medicine training and background to provide full scope, personalized medicine for high performers, people that want to be better versions of themselves, that want to maximize health span and not just lifespan. And that's where Gabrielle Lyon and I really resonated. Exactly why I'm jumping on to join her practice, because she focuses on exactly that. How do you become the best version of yourself? How can we help accelerate you from where you're at now to where you need to be, where you want to be? And her focus on muscle as the organ of longevity, and basically focusing on optimizing the health from a muscle context perspective. That just, health and wellness optimization is a byproduct of that effort.
Yeah.
And it resonates fantastically with functional medicine.
Well, it sounds like that's where your passion is. So it sounds like everything's kind of working in your favor, kind of the universe is conspiring for you to make this move. And I love the message behind the muscle centric and the protein focus. I don't know. I felt like as soon as I started hearing that message, it made so much sense to me, as if I'd always known it. But just to have that as one of these super, like, now it's getting to be a really dominant message. It's very comforting. And as a man that likes to be big and strong, I'm like, yes, this validates like what I like to do,
Yeah.
But,
I continue to store snippets of some of her words. I mean, not that we're over fat, we're under muscled, and little things like that. Like muscle is the epitome of. Yeah. That resonated with me fantastically.
Yeah. Well, I remember when we had our discussion, I think it was a few months ago, you had a really interesting story that got you to work what you're doing right now. And would you mind sharing that? You remember we talked about like your history as a firefighter, paramedic, and all that stuff?
Yeah, I mean, going all the way back when I was a kid, before a lot of my memories were really starting to be forged, I had leukemia. And I'm a survivor for acute lymphocytic leukemia. And I was diagnosed around the age of 3. I remember my mom saying that I just was saying I was really tired. I was really tired. Now,
I lost you right there. I lost you right where you said you remember your mother saying you were really tired. If you could start there again. Sorry.
Gotcha. No worries. So, my mom was didn't know what to make of this happy-go-lucky kid, really energetic kid, saying he's tired all the time. So she took me to the doctor's office. They diagnosed with leukemia, and luckily enough, by the age of 5, I was in full remission and without evidence of disease.
Do you remember that?
And really what got me there, I remember honestly spinal taps
Yeah.
were pretty vivid memories. And my dad, it's vivid for him too, because he had to like hold me down and literally hold me in a pretzel so that I wouldn't move and mess up the procedures.
Oh man.
Um, yeah, some bits and pieces, but to be honest with you, I'm pretty lucky in that I was a bit too young to remember anything more than that one part of the treatment. But otherwise, it was famous people visiting me when I was inpatient for months on end in the kids ward. It was picnics and the smiling faces of the people and the care teams that were helping me. And Make-A-Wish Foundation actually granted my family a wish, and the person that engaged us, that was the face for Make-A-Wish Foundation, was a firefighter. And lo and behold, 20 or so odd years later, I became a firefighter. And I don't know if that was something going on subliminally in the background, but I knew I wanted to help people, and I knew I was good at learning. My dad always said, get a government job. And I went on to become a firefighter. And when I
You were
got
inspired
pinned,
by those people that helped you and stopped by,
yeah,
probably. It's a big part of it.
definitely. And,
Yeah.
and my dad sought out the guy that was the face for the Make-A-Wish Foundation. So when I graduated Fire Academy, he actually had that guy show up and pin me for the fire service. And that was
Oh,
phenomenal.
wow. That's great.
Yes, came full circle there. So as a firefighter, I really enjoyed the medical aspect of it and the challenge of it. And I got hired young onto a department. I was 20 years old. And by 21, our department was growing so fast that I ended up getting put into a position of leadership in charge of some guys that had retired from other departments. So, that was pretty unique for developing me as a person, as a professional, and my leadership style, because I had to harness the wisdom and the experience of these guys around me, because they knew way better than I did. I was just the one with a position of authority, and that meant nothing in my eyes. Like, I needed to learn from them.
Yeah.
So
That's
yeah,
that's a true leader, right? That's before you even got into the military.
right.
That's great leadership right there.
Yeah, that experience was tremendously, shaping.
Yeah.
So I was good with the medical stuff, and the guys around me knew it. They nicknamed me Doc because I just really enjoyed distilling complex concepts down to like bite-sized, memorable ways of thinking. And that probably set me on a trajectory, because I ended up doing undergrad thinking, let me go physician's assistant or nurse practitioner or something like that, because there was some courses that could bring you from medic to nurse or medic to PA pretty quickly. But when I was in undergrad, had a chance to shadow a few ER docs, and I said, man, they get to do really cool things, a lot cooler toys, a lot better training, and a lot more money. This is something I can do. They're doing the same thing that I'm doing in the back of the box, back of the ambulance, making these hard decisions and making sure, you're there as a change agent at an emergency, in an emergent point of life when people have literally hit rock bottom, either physically, mentally, or both. And
that's how you were seeing it at the time. You were saying to yourself, like, this is where I want to be, is at these transitional moments that are very challenging. You had that awareness.
Yeah. I'll be honest.
That's great, man.
Share something personal. I don't have any tattoos, but I envision like two, and one would be that of a tidal wave. And with the tidal wave, there's this Asian theme drawing. And it's called The Wave. But in literature, the water signifies change, and a tidal wave on top of that is just a tremendous agent of change. And yeah, I think I'm a force multiplier. My life mission and purpose is going to be to serve as an agent of change, but doing that collaboratively with others. So 100%. There you go.
That's great.
But coming into medical school, I originally thought emergency medicine would be an extension of what I was doing at the fire station. But I caught the bug. I caught the bug for food as medicine, exercise as medicine. And I picked up some mentors that were part of the Exercise as Medicine International Initiative. And this one mentor of mine particularly said, hey, there's this lunchtime lecture. This guy, his name's Mark Hyman. You should probably go check him out. And it was my first month of medical school, and that was a game changer. So I had the pleasure of having my first experience learning about functional medicine from the mouth of Mark Hyman, talking about patient cases where they leveraged food as medicine. They leveraged exercise as medicine. They leveraged these integrative herbal and nutritional therapies that in my heart, I knew intuitively, like, this makes a difference. This is important. And here was this whole community and this whole group of professionals that do this for a living. And that created this alternate reality for me, that I was like, okay, cool. I'm at the outset of medical school here, about to learn, to pass the test, but I don't care, what needs to happen. I'm going to align with this program that was getting launched at my medical school. So all 4 years of medical school, come hell or high water, every other Saturday, I was giving up my Saturdays to go learn from these functional medicine practitioners that were from the area at all different ends of their professional spectrum, and learning about functional medicine and what's possible. And
what was that like? What was that like, attending those things and at the same time going to med school and having that whole, that dichotomy? That
it was exciting. It was tremendously exciting, but it was like it was almost like a dirty little secret, because
you were like the special ops or something like that. You felt like you were this. Okay, we're in the know.
Yeah. It was enlightening, and at the same time, it was almost a little like the healthy deviant concept, to where everybody's swimming this way, and I felt like I was kind of swimming this way, maybe diagonal at times. It's a path less traveled for sure. And I wanted to share it with anyone and everyone that gave me the inkling that they were a bird of a feather. So I got so excited with some of the integrative minded, nutritionally minded, exercises medicine minded colleagues, and we had some student interest groups that we created. MedFit was one, and there was another one, functional medicine interest group. But we tried to pull out and draw out those peers, those birds of a feather, and usher them over to this functional medicine training. So had that exposure, that experience, and had some fantastic mentors that I gained through that pathway that said, hey, your last month of medical school, you got to go to this Loma Linda rotation. And this rotation that is set up with the medical school in Loma Linda, it's the only one of its kind in the US. Go learn about functional medicine in a formal way. They've got a rotation over there. So I did.
Is that where the institute? Is that where the institute's at?
Negative, right? This is Loma Linda University just has in their preventive medicine department, they have a month-long elective rotation for functional medicine, or people that are in medical school that want to learn more. They can do an elective rotation over there. Learn from Datis Karazian and some functional medicine practitioners in that region. They paid and took their own time to come teach at that course. Fantastic experience that lined me up for doing the functional medicine training and certification pathway. And throughout the 3 years of residency training, I completed the coursework for functional medicine certification, and just once again further trained that additional brain, not the one that was trying to pass the test, but the one that was learning about what's possible. And I got to tell you, the more you learn these things, first off, you can't unlearn them. And your brain starts thinking differently. And that's the beauty about functional medicine, is it treats you to start looking for the root causes of dysfunction. And root causes of dysfunction, there's only so many. So it's so much simpler. And instead of complexity, it's simplicity. I've heard that term used multiple times, but it truly is. Like I can identify 15 different patterns of dysfunction, and I can think about these root causes of dysfunction and identify which of these 15 are the most important for this person sitting in front of me. And then how do we get after it? How do we assess that? How do we address that? And how do we empower them with information that tells them, hey, this is under your control. These are things you can do. This is how I'm going to help you.
I love that. I love the simplicity of that.
Yeah. So finished military residency, and jumping into practice on my own. I really got trial by fire. I jumped in and absorbed a geriatrician trained family medicine docs panel, and it was at least 70% of veterans, military veterans. And if you know about that, then you know that chronic comorbid pain, and like they've, when you talk about complex and starting off complex, like that is 100% one of the most complex ways that you can start practicing medicine, especially primary care. But that was a blessing. It truly was, because it got me so comfortable in my own skin, got me comfortable with uncomfortable, got me comfortable with utilizing my team, leveraging my team, and empowering my team to do more and maximize their scope. So also learned how to incorporate functional medicine in a PCMH model, patient-centered medical home model, which is extremely tough to fit anything into with 15 to 20-minute appointments throughout the day, seeing 16 to 22 patients per day. And here I am, a functional medicine trained doc, thinking differently and having to figure out how the heck do I do things differently.
Yeah,
and
with that limited time and that limited resources.
So that kind of paved the way to gaining skills, knowledge, skills, and abilities that made me a good steward for military functional medicine community. And I got connected through mentors to Walter Reed, National Capital Region Pain Initiative, who was launching a functional medicine training pathway. And that was music to my ears. The fact that, hey, there is a DoD funded, a military funded pathway to learn functional medicine, and they're treating physicians, nurse practitioners, PAs, even doctors of physical therapy, chiropractors, like anyone that serves the military community is able to get training here on the military dime. And I've been part of that for the last 4 years now, and we've got over 250 physicians trained through that pathway. It's been phenomenal being exciting. A part of growing that community, growing my community.
That's encouraging. Mm-hmm. Like, it's like, is it spreading like wildfire in the medical community or the military medical community? What percentage of medical professionals are kind of functional trained or have some exposure to it versus traditional medicine?
I wish I had better stats just to kind of point out the birds of a feather, because amongst the people that are lifestyle medicine, integrative medicine oriented, precision and personalized medicine aligned, this functional medicine clinical operating system, the operating system and the framework of care really resonates with them. And the ones that get the training come out tremendously energized, ready to do things differently, but then they are getting fit back into patient-centered medical home model of care. Some of them have the luxury and the freedom of movement with the special operation community members, and also specialty clinics. They have more freedom of movement, but we get a lot of primary care practitioners that are struggling because they come out energized, knowing these new things. You can't unthink them, and fitting it into the model is a huge challenge. But that's another area of focus that we then teach them and then work with them afterwards, after that training pathway, to try and build up some of those skills and share some of those lessons learned of how you fit this into 15 to 20-minute appointments.
That's great. That's encouraging to know that that's happening. Do you mind if we just backtrack a little bit and just, Dr. Stepp, could you just explain what is the difference between a traditional medical doctor versus functional medicine? Because you brought up this term root cause.
Yeah. So the tagline, first off, there's layered responses to what is functional medicine and what's the difference. The biggest thing in my first immediate response is that it's a framework and an operating system. So it's a way of doing personalized medicine and delivering lifestyle and integrated medicine that addresses root cause dysfunction. Another way of saying it is that it's a person-oriented medical approach rather than a problem-oriented medical approach. So rather than labeling a collection of symptoms and findings with a diagnosis and starting with the problem, this is a way of understanding a person in context over time and identifying those root causes of dysfunction and using personalized lifestyle and integrative modalities to address them. Now, root cause of dysfunction. There's a great acronym that has emerged from our work over the last 5 years in the military functional medicine community, and we incorporated in our training pathway. And the acronym, I'll just blast through it with you real quick. The acronym is STAINED, STAINED. So and I'll just rattle off what they stand for. But so sleep, stress, SNPs, trauma, toxins, tablets, allergies, autoimmune, and under allergies, it's also sensitivities and intolerances. And then N is nutritional excesses and deficiencies. The E recently was added, that's EMF and radiation exposure.
I love it.
And D is digestion and dysbiosis. These are the things that we teach them to look for in the patient's story, their life events, their health events over time, their exposures, their lifestyle habits, getting to know the person sitting in front of you. These are the things that we look for. So those are those kind of 15. I'll be honest, I haven't counted it in a while. It may or may not be 15.
I was like stained, STAI,
right.
But there's each letter has several words.
Public math, don't do it. Yeah. I've learned better. So that's kind of the root causes of dysfunction that we look for. And the fun part, the truly fun part of my job as a functional medicine educator is helping people figure out how to think about these exposures, not only in everyday life, but specifically in the military operational environment. And now as I'm transitioning from, military community to civilian sector and helping a broader audience of high performers achieve health and performance optimization, that framework directly translates. Those root causes of dysfunction directly translates. So that framework is still there for me. And it's still super easy to mentally categorize these things and look for these root causes of dysfunction.
Yeah.
Now,
does this kind of tie into? Oh, go ahead. Sorry.
No. Later on, I'd love to mention some of the more common ones that I think will definitely resonate with lottie-dottie everybody. I don't know if you remember those terms, a bunch of militaryism. So,
I was going to say before our call, hey, our first talk, you had a lot of acronyms, and I was like, I understand these things. I don't know if anybody else would, but yeah.
So I'd love to touch on some of those afterwards, but you had a question.
Oh, well, I was going to ask, does this tie into, again, because I'm just thinking about my members in my community and the people that'll be listening or watching this. What are specific symptoms that we should be paying attention to that's telling us something?
So I think, and this is how I encourage anyone to kind of breach that level of a simple question that it's actually extremely complex to answer, is mentally categorizing those root causes of dysfunction allow you to identify check engine lights in that area, in that category. Because when you understand that exposure, its impact, and early symptoms of early dysfunction, that'll prevent things from progressing to disease, disability, even untimely death. So an acronym that I actually thought of this morning that I'd love to share with your audience that will help us kind of categorize some common ones that I think will be helpful for them was S.E.X. And
yeah. That resonates with our community. I mean,
there you go.
We're the SHT, so like, I love it.
Beautiful. So sleep and stress, we'll talk about.
Okay.
Elimination habits, specifically around hydration and bowel transit time. And then exercise, we can talk about understanding, how much is too much, but then also what's ideal. And then with exercise, having a mindfulness-based physical activity. And I'll explain what that means.
Yeah, I love it.
Yeah. And with sleep, we'll start off and saying, hey, check engine lights. If your sleep is crappy and it's been crappy for a while, then you're going to notice difficulty concentrating, difficulty feeling motivated, energized, brain fog, irritable, maybe even a bit anxious, might not realize why you're in such a crap mood. But it's a lot of kind of mental health symptoms and then physical health symptoms too. So hunger pangs change, and you're your preference for food selection is going to change. Like you're looking for the
Absolutely,
fatty,
yeah.
you're looking for the sweet, you're looking for the immediate dopamine hit because you're lacking, some of those feel good hormones, and you want more of it. So yeah, food.
It's like your body's craving energy because it's so tired, and it just makes you snacky. It is bizarre. Like the rare times that
Yes.
I don't get good sleep, I'm like, man, why am I so snacky today? And usually that's it.
And there's definitely studies that reinforce that sleep deprivation chronically will does lead to increased caloric consumption throughout the day. So, I mean, a simple thing like, and this is the intervention side, so the assessment and intervention would be quantifying your sleep, quantity and quality, and using some of the wearable tech, especially one that has accelerometry. Basically, they can measure your steps and movement throughout the day, as well as HRV, heart rate
Do you have some
variability.
recommendations for that for some of your favorite devices?
Yeah, so with the military community, as well as anyone that's interested, the wearable tech we talk about is Garmin watches have a great selection of watches that have HRV capability, accelerometry. Some of them even have oxygen level tracking throughout the night, which is phenomenal, especially for the military community or anyone that thinks they might have sleep breathing disorders. So Garmin devices, Whoop devices, Aura Ring. I know a lot of the wearable companies are acknowledging the value of HRV and using that as an indirect marker of stress over time. And they're pairing physical activity, movement throughout the day, sleep quality and quantity throughout the night, and stress into composite kind of readiness metrics. And yeah, being able to track your quantity and quality of sleep and measuring your stress throughout the night with some of that wearable tech is probably one of the best things you can do for yourself.
Yeah. So subjectively, you're saying just paying attention to how you feel, like some of the things you mentioned, like the irritable stress, being snacky, just feeling tired in general. But then objectively,
Yeah.
it'd probably be useful to quantify your sleep duration and your sleep quality using something so you have something, some baseline to compare
Yes.
against. Yeah.
Yes, definitely. And I'd say with that, not only being aware of how you feel, but being aware of how those people around you are acknowledging your mood or state of being.
Or how much they're
Sometimes,
irritating you.
yeah. So maybe it's how much they're irritating you, or them being like, "Hey, man, like you're off your game.
Yeah.
Like I don't know what you're doing, but you gotta rethink it. Like maybe today you just had an off day. Maybe you've been having some off days a lot more recently." Being aware of those comments,
Yeah. Yeah.
and picking up what they're putting down, like, hey, maybe you should assess things a little further. Stress, we talked about HRV already and some wearable
Mm-hmm.
tech there, but chronic stress, foot on the gas pedal, not having a strategy that works to actively hit the brake pedal. I'm using those analogies, but basically, what does active relaxation look like? And do you maximize those opportunities throughout the day to actively relax? Reflective activities like prayer, journaling, meditation, mindfulness based activities, even just taking a break to get outdoors and getting out into the greenery, being mindful of your surroundings and just soaking it all in. Even media fasts, technology fasts, getting away from your electronic devices for a little while. So stress, but the inverse of stress is also going to reduce stress, and that's maximizing opportunities for joy. What's your sources of joy in your life? And if you don't have any, how do you get them back? What were they before? Because that's probably the lowest resistance to getting back to some type of joyful practice or activity.
Finding
So
things that you enjoy. So from a stress management standpoint, if I hear you correctly, you're saying having some kind of a daily practice is probably really beneficial. Making sure that you take breaks from whatever it is that's focusing your attention. And for most of us, it's usually something work related, right? So that's ways you can be proactive. And then what was the last piece we just mentioned? Acknowledging those things that make you happy and bring you joy, and trying to make sure that you find ways to fit those into your life.
100%. And connection. I mean, social connection and keeping positive relationships and nourishing those positive relationships around you, especially with strong mentors, close friends. Like if a friend or family member continuously brings you down and puts you in a negative emotional state, you know enough to realize when that's not a good thing for you right now. And you can probably pull away or put some distance between those individuals and you, at least while you're in a time period where you're nourishing yourself. You know?
Yeah, that sounds great.
So
And then
elimination.
I was going to say elimination. We're talking about digestion,
Yeah.
pooping, and stuff like that, right? Okay, cool. Yep.
So yeah, with regards to how you metabolize, process, and eliminate things that you expose yourself to throughout the day, since we kind of live in a bit of a toxic environment, you really got to make sure these systems are robust. So from a hydration status standpoint, yeah, the color of your urine can be helpful. And whether or not you walk around with chapped lips and a dry mouth, like those are good physical signs of whether or not you need more hydration. But in general, there's a couple of benchmarks. Your weight in pounds divided by 2, especially if you're an active individual, is a good goal for how many ounces per day to drink. And that goal plus those physical symptoms can tell you if you need some more hydration. But urination is just one of the ways that we eliminate metabolic byproducts and waste. Another one is through our poop, bowel and bowel transit time. A very fun test that I have my patients do is a sesame seed test. Essentially, you take a teaspoon or a half teaspoon of sesame seeds and you see how long it takes to come out the other end.
Because you can see them in your stool.
You got it, right? It's almost like the corn kernels, but yeah. So sesame seed test, taking a look at transit time. Half a day to a day is okay, but if you're going beyond 24 hours and you haven't seen those sesame seeds, like you've got a lot to focus on. Maybe it's more activity, maybe it's more hydration, maybe it's more fiber. When I say fiber, I mean vegetables, roughage.
Yeah.
So yeah, hydration
I
status, bowel
love
transit
that.
time.
I've never heard, like, I know, well, first of all, I talk digestion with my clients. Like that's, one of our first pillars. But I've never heard of that technique of sesame seeds. I think that's freaking great because
It's a fun
the
one.
reality is,
Yeah.
like, do you see more constipation, more slow bowel movements, or do you see more loose stools in your
Way
experience?
more constipation.
Me too.
Way more
Yeah.
constipation. I actually had to reframe how I ask questions to get at whether or not someone is constipated, because I'll say, hey, do you have regular bowel movements, and do you have normal stools, and rather than just asking how often do you have bowel movements, they'll be like, oh, I'm regular, like I'm okay. And for them, that regular may mean once every 3 days.
Yeah.
So I started asking my buy-in straightforward question is, hey, how many bowel movements per week? And it's such like it kind of pushes them back, and they're like, what? And for some, they'll straight up answer like 2, 3. And those are the ones that I'm like, let's hear more about this. But the ones that really kind of step back and they're like, oh, 1 or 2 a day, doc, I'm like, okay, cool, you got the right answer. It was a trick question.
Yeah.
So yeah, definitely see a lot more constipation. Yeah, especially if a history of like combative sports, contact sports, and traumatic brain injury history. There is vagus nerve autonomic control of the gut and intestinal motility that will change with chronic traumatic brain injury exposure. Yeah. So, there's actually,
we're looking for, go ahead.
I was going to say vagal tone exercises can help with that. Pelvic floor exercises can help with that. And just focusing on physical activity, hydration, and fiber intake can help with that.
Cool. So transit time is really important. And then any other digestive maybe symptoms or things we should be paying attention to?
So, I mean, things like itchy rectum could suggest that maybe a bit of a candidal overgrowth, especially if that's in the context with a lot of fungal burden in the body anyways, athlete's foot, jock itch, and itchy rectum, and symptoms after eating. So bloating, belching, maybe some reflux that can actually be related to things where you've got bacterial overgrowth in the wrong portion of the intestines, higher up in the intestines, so small intestinal bacterial overgrowth, or that could be candidal overgrowth. So that's a yeast, and that loves to thrive on sugary foods and carbs.
So those
You
symptoms
can,
are not normal, y'all. If you have
right,
after meals, you're always experiencing, the gas, bloating, belching, heartburn.
right.
We need to work on.
Spot on. Yeah, it could be as simple as lactose intolerance, but even lactose intolerance can create dysfunction, basically, that can bait bacteria that's supposed to live in the large intestine up into the small intestine. Since you're digesting the lactose poorly, it is food, it is bait for those bacteria to come up and have a field day in the small
Wow,
intestine. And
interesting.
that sets the conditions for a small intestinal bacterial overgrowth. So yes, you might be lactose intolerant, and yeah, you might get some early symptoms, some mild symptoms of just bloating, belching, but that can lead to a larger problem.
Wow.
So yeah, little things like that. Exercise is the other one I was going to mention, and that's the X. And first off, the metabolic benefits of exercise stick around for 48 to 72 hours. So ensuring you're getting some type of physical activity, things that increase your heart rate, things that make it difficult to sing or hold a conversation while you're doing that activity, that's moderate to vigorous intensity, every 48 to 72 hours at minimum, is going to maintain some good metabolic benefits. And that's also brain health benefits. Feel good chemicals start flowing, and all your neurotransmitters start basically communicating, and your cardioprotective and cardiometabolic benefits are going to stick around. How much is too much? That's where the wearable tech comes into play. You can start seeing resting heart rate elevating in the morning. So that can be a direct measure of how physically stressed or mentally stressed your body is. So resting heart rate can be elevated. Your stress levels or HRV readings can be different in a more stressed state.
Mm-hmm.
And if that is chronic, and you're taking a look at the days where you did hard exercise and your HRV readings and resting heart rate readings the following day, you got to ask yourself, like, am I giving myself enough space and time to recover? Am I giving myself enough nutrients and calories to recover? Am I recovering at a rate that is appropriate for the level of exercise and output that I'm doing? So that's something that you can do. And if you don't know, you can ask for help.
Yeah.
Uh,
So the wearable tech gives you this ability to have an awareness and at least ask the question, why are things different? Was it because of my stress levels, my activity levels the day before? Did I not sleep well last night? But that
You got
awareness
it.
allows you to step in and do some kind of intervention, or at least ask the question.
I'd say the difference between having that information and not having the information is like going to the mechanic. Hey, it's making this funny noise, and you don't know anymore. They don't know anymore. So they're going to do a deep dive, and then they quote you on this list of things they want to do for your car. They think you need it. You have no clue whether or not you need it, and it costs this bunch of money. As opposed to knowing exactly where that noise is coming from, which check engine light it corresponds to, and having read in the owner's manual exactly what that means. You're going to have a very different conversation with the person sitting in front of you that you want to help. You want to help you. So yeah, it's the difference between knowing exactly what you need at the mechanic shop versus showing up and knowing nothing and being like, hands in the air. Hey,
it gives you some really, really useful information.
100%. Yeah, that's immediate feedback on your actions to tell you whether or not they're effective. And that gives you the opportunity to self-experiment and do early interventions, self-care first, see if it makes a difference, see if it moves the needle with your metrics, with your lifestyle data.
Nice.
Definitely.
Now, you mentioned the benefits of cardiovascular exercise, 24, 48 hours. What's your stance on resistance training? How important is that to throw into the mix?
Yeah, definitely. So I'd say at least every 48 to 72 hours as well. The metabolic impact can be very different. It targets different tissues, the health of different tissues. So there's systemic benefits to both. And there's slightly different, but there's a lot of overlap. So the brain health benefits, the anti-inflammatory chemicals that get released, the BDNF or brain-derived neurotrophic factor that gets released, which is miracle grow for the brain, the feel-good hormones that start flowing, you get benefits for both. But resistance exercise in particular, especially when we're talking about that muscle centric medicine focus, how do I want to optimize the muscle health and muscle quality? You need resistance exercise training. And that is going to help support the signals for growth, the signals for maturation, and the signals for differentiation of muscle tissue that needs the right signals to grow, get stronger, get healthier. So
and
yeah,
that
100%.
signal kind of, it lasts for a while, right? A really good resistance training session is going to give you some muscle protein synthesis for a solid 24 to 48 hours, just like the cardiovascular exercise.
You got it. I'd
Yeah.
say at least 3 times a week would be ideal. Get in some resistance exercise training. And there's tons of ways of getting after that. You can focus more on volume, lower weights. You can focus more on time under tension, which reduces the injury risk because you can use less weight and just focus on going slower. And you can do HIIT, high intensity interval training. And there's all kinds of ways of getting after it, especially with body weight, some weights, heavy weights, and doing it in pairs, doing it in groups is always a plus. Yeah, you get people that can help tell you if your form is starting to slack, if your injury risk is going up. Be like, hey, slow it down, like drop to this weight. They'll give you that feedback. They'll help you out. You got a buddy that's a social support and accountability partner. Like doing it with others is always going to be a little more enjoyable, unless that's part of your mindfulness-based physical activity. So some people love to zone out, de-stress, get the headphones on, get the Pantera flowing, and just really get into your workout. It just depends on how you incorporate that physical activity dose into your routine.
Yeah. There's a tremendous benefit to group classes. I was a part of a CrossFit gym for a while, and a lot of our members were also members of that gym. And I love the push, and like you said, the quality coaching. Now we find ourselves in this more of like a Globo gym, and I've got my headphones back in, and everyone's doing their own thing, and it's like I can't tell which one I like better, because I do like the group class and the push and the friends and all that stuff, and I also like you said, it is a good little mindfulness practice sometimes, just be in your own head.
And I think those group physical activity experiences are so important, especially if they're in your local community, or even if you're only in an area for a brief period of time, because literally all you need to do to join a community, to build your community, is walk in the door. Now, if we incorporate this into the functional medicine training pathway, but how do you define community? And if you have a very clear definition of community, then you know how to build it. From my perspective, it's a group of individuals bound together by shared gifts, experiences, shared stories, gifts, and experiences. And when you talk about shared exercise bout, and everyone going through the same suck and the same struggle together, like that's a shared experience. And then you're going to have stories about it afterwards.
Always. It reminds me of the military, like at that CrossFit gym. And I've got a couple members in here right now. We had some really brutal workouts, but afterwards it was all glory,
And I joke with my patients and talk to them about the different types of fun, types 1, 2, and 3 fun. You familiar with that one? You heard of that or no?
No.
All right. Type 1 fun is great, fantastic at the time that it's happening. So it's like everyone's smiling, having a good time. Type 2 fun. Yeah. Type 2 fun is where it sucks. Nothing about it is enjoyable. And you know what? Later on, hours or days after the activity, you're looking back on it and you're man, that was a good time. That was hard. That was tough, but that was a good time. Now, type 3 fun is no fun for anybody. Totally sucks. Even thinking about it brings back, some negative emotions and memories and repulsive kind of feelings about it, but it makes for a great story. And that's type 3 fun.
All right. I love that. So I'm just going to throw in a little anecdote there. We did there's a hike up to Mount Charleston in Vegas, or just outside of Vegas. And it's a 20-mile round trip. And that would be a type 3, because there was nothing enjoyable about that at all, but it was some good stories. I don't know
for a great story.
Yeah.
And you get to share that with your community, right? Shared gift stories and experiences. There you go.
Absolutely. So then
someone said every one of your members said every hero workout is a type 3 fun.
Oh, that's right. That's right. You're familiar with the hero workouts, right?
Oh yeah, yeah.
Oh, yeah.
CrossFit. Well, wife's a CrossFit coach.
Oh, nice.
Mhm.
So that's the exercise. And the last one in our acronym S.E.X is, or you
Mi-
had mindfulness in there somehow. How does that?
yeah, a mindfulness-based physical activity.
Okay.
Now,
Okay.
I've
That was
found this
the
to
last piece we
be,
were talking about.
yeah, you got it. So I found this to be tremendously helpful with fitting functional medicine patients into a crunch time window, to where functional goals. I have to look at functional goals. What's the biggest the biggest and most important thing to you that you're unable to do because of your limitations, your conditions, your biggest barriers? And sometimes it's a physical activity, and we can use that. But if it's not, then I start looking for physical activities that they've done in the past that are mindfulness based. So something like archery, something like golf, something like ping pong, to where you really got to get in the flow, in the zone, in the moment, and you got to be present, no distractions. And using those mindfulness based physical activities as a gauge of how they're doing today. And getting back to those activities, especially if they brought joy or peace to them, because it's actively hitting the brake pedal. It's actively prioritizing joy. And it's a mindfulness based activity that if you're having a bad day, your performance is going to be off. You're going to know it. And if you're spot on, really doing something right, it gives you the opportunity to look back and be like, man, what were the conditions that set me up for doing so well today?
Yeah.
And it's a gauge for whether or not the things that you're doing, that you're trying, are working.
So
So
I love that. Something that's intention based. Now, would you include walking in that, or are you looking for something a little bit more skill based?
it can be any type of activity that they're able to disconnect, tune out, and realize the difference. So if it's something like walking, then perhaps incorporating some measure in there of start and stop time, heart rate and heart rate variability throughout the activity, but being able to look back at the activity and be or even in the middle of the activity and be like, how am I doing? And how's my performance today?
Yeah.
So
So
yeah.
something that forces you to be a little bit more present moment based, and then something that you can also measure whether you're doing good or bad or better or worse or something along those lines.
Right. So if it's archery, how far out of the center bull ring are you consistently hitting? Are you consistent with your hits, or are you way up, all over the place today? How's your breathing during your golf stroke? Are are you hitting where your desired target is, or are you way off base? And sometimes it can be fun, enjoyable activities with others. What's the name of that golfing place where you get to go and
Top golf.
Top golf?
Yeah.
Yeah, see, it can be
Well,
enjoyable with others.
yeah, 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 yeah. No, and ping pong, spike ball, like we love those things. What about so if I hear you right, we've got the fitness component, which is you have your cardiovascular, you've got your resistance training, those give you these physical benefits and some mental benefits. And that now you're talking about a more mindful practice. Would lifting weights also count as a mindful practice if you're trying to, PR your back squat, or you're looking to do, better on a certain Metcon or something like that?
It can 100%.
Okay.
Everyone's prescription and personalized treatment plan, or personalized, optimization plan is going to be different. For some people, their limitations with injury risk or prior injuries are going to prevent them from doing some heavy PRs, or maybe that just wasn't for them. But yeah, by all means, if getting in the gym, getting after it, and going after PRs is your mindfulness-based activity, your intentional activity, then 100%, uh, sure, I can 100% meet the
Yeah.
need.
And then do you have a frequency that you'd recommend having these mindfulness space activities, like per day or per week or something like that?
At least 1 to 3 times on a weekly basis, even if it boils down to something they can only do every other week or even once a month. It is a yardstick for them, and I try to focus on that as an opportunity to see how things are going, to see how you're able to perform that activity. how well are you able to perform activity? How do you feel while you're able to do it? And the more frequent you can, utilize that yardstick, the more feedback you're going to get on how you're doing and progress towards your goals.
Yeah, so it sounds like one of the keys to these mindfulness-based exercises would be an intention of it being that for you. So going into it with the intention of like, I want to make sure that I'm having my focus and I'm being deliberate about what it is that I'm doing here.
You got it. And those other stillness practices and reflective practices, those skills of breath work and mindfulness are going to help you clear your plate and help you set that intention and help you be mindful during those activities. So that's a way of showing them results from the skills that may seem nebulous right now. So it really just makes it more tangible for them.
I love it. I love it. So thank you so much for putting that acronym together. You guys, I think we heard it here first, S.E.X, for sleep and stress, exercise, sleep and stress and elimination habits, including hydration, and then also exercise, which included the mindfulness exercise. So Doc, we're coming up on about an hour. I had a ton of questions, that I'd sent you before. Do you feel like there's anything in here that we would like to end on or finish on? And I would love to have you back because I feel like there's a lot of other things that we need to talk about or could talk about. Was there anything that we felt like would be super, super useful to kind of end on? And then that way we have a few minutes for some questions.
I think one of the biggest things I would ask of your community is don't be selfish with the knowledge gained, the lessons learned, the experiences that you have. Build your community, share those gifts, stories, and experiences, and get the right interventions to the right people at the right time. I mean, that's precision population health right there. And that's just knowing the resources around you, how to engage services for the check engine lights that you're seeing, and being able to have conversations about those check engine lights with others in your, others that you care about, that you want to see perform better, feel better, and have a better quality of life. So, be the healthy deviant, but don't make it your dirty little secret. Have those conversations with everybody and share those gift stories and experiences with others.
Man, that's so appropriate for the times that we're in right now. Speaking your truth, at least letting your actions speak for themselves, but speaking your truth. And I love it as it pertains to health, like sharing the gift of health. And if I hear you right, also just paying attention, like you said today, having some awareness of your own self and your symptoms and how you feel and how you're looking and feeling and performing, and knowing, whether you're off or you need to address some things, but also having the courage to share that information or acknowledge it in someone else and offer some support based on your strength and skills.
Mm-hmm.
I love it. I love it. So Doc, man, that was great. Again, like we only got through maybe like 4 of the bullet points of like 20. Okay. But we're at an hour. I want to thank you for spending your time with us today. And I'm going to open it up and see if we've got any questions from our people in the group here right now. So Chandler asks, what is the single most impactful health decision I can make from a functional medicine perspective?
I was thinking about this one. One of the bullet questions beforehand was, what are the things we can start doing immediately? And I'm a huge proponent of keeping it simple. I'd say half your plate veggies with the high quality proteins. And everyone's got different protein needs, but higher protein. And the simplest thing and the easiest starting point is half your plate veggies. Make it diverse, make it colorful. And that's going to give you the fiber that you need to have regular bowel movements, optimize your elimination pathways. That's going to give you a bunch of micronutrients. And the more colorful, the better. But make it a regular practice, not only for you, but your family members and those around you. Give them some crap until they start doing it. But half your plate veggies. It's such a simple and easy starting point, but it's such an impactful one for gut health specifically. And that directly translates to brain health, performance, resiliency, recovery, like half your plate veggies.
I love it. It's a simple visual too, very, very easy to follow. Is there such a thing as a no-pill doctor?
Yes, there is. So when you talk about functional medicine community, we all agree with a therapeutic order. And the therapeutic order of things kind of follows the naturopath line of thinking, to where you want to support the body's innate and natural ability to heal first. And that resonates with the lifestyle is medicine, the exercise is medicine, the food is medicine community. So you're going to find personalized medicine, lifestyle medicine, and functional medicine practitioners that resonate with, hey, I don't want pills. Like, I'm here to see you. I can go to a primary care doc and I can get a pill for an ill, name it, blame it, tame it, bill it, refill it strategy. I don't want that. I'm here because I want to start with what I can do first. I want to start with movement, nutrition, connection, sleep, stress, those things. And 100% you'll find those docs. And I think we're going to start finding more of those docs, because you got docs that are disillusioned with the conventional approach to care.
Yeah, more and more are getting disillusioned. I think I heard some statistic recently about how many MDs were getting out of the business just because, you know, it wasn't what they thought it was going to be.
Got it.
Yeah. Well, Kathy asked something, and it was one of our questions.
Mhm.
First of all, Kathy, she's 70 years young, and she's doing all the right things. Like, she's been with me for a really long time. She works out really hard. She eats real food, 100%, has a mindfulness practice and all that stuff. So she's asking, what is the most important thing that you can do to stay healthy?
Yeah.
But do you have any insights on that? You know, what are the most important things or thing that you can do to stay optimal in the context of someone that's doing a lot of right things anyway?
First off, sounds like Kathy's awesome. And Kathy, I would say, for someone who is starting to get above the age of 50 and focusing more on maintaining brain health, body health, hormonal balance, and hormonal health into older age, I'm starting to get towards that trajectory as well. Honestly, focusing on muscle health, focusing on incorporating some resistance exercise training, on building the health and the integrity of your muscles, will 100% translate to your ability to function into your older age, will translate to brain health, being present and able to engage family members, to engage loved ones as you age. So really, from a standpoint of muscle centric medicine and being a huge proponent of it, focus on muscle health and do what you can do to stay robust and functional into your old age. That'll prevent injury risk, that'll maintain bone density, that'll maintain hormonal health, that'll maintain brain function.
Doc, I love it, because that's exactly the track that we're on right now. The past few months, it's been our big focus, is just talking about protein and emphasizing resistance training and things like that. So, Kathy, I feel like you can check the box on that. But this is just confirmation to keep doing what you're doing. But she's asking, is there too much? And I think that goes back to what you were saying before about paying attention to your check engine lights.
Yes. So, Kathy, thank you for that question. There's definitely the possibility of someone doing too much. Now, it's a factor of your body's ability to bounce back, and what you're actively doing to bounce back faster. So let me parse that out just a little bit. Sleep, definitely a big part of that. Your body's ability to bounce back. Micronutrients, making sure you're getting adequate micronutrients and macronutrients is extremely important. So not only the adequate calories from carbs, fats, proteins, but also talking about things like vitamin D, magnesium, B vitamins, iron. And these are all things that people can typically and historically be low in. And if you've got high muscle turnover rates like CrossFit community, then you may need uniquely higher levels of some of those micronutrients. Vitamin D is so essential that we consider it a hormone. Your level should be in the 50 to 80 range on blood work. And if it's not there, then you can get it there by maintaining something like 4,000 to 5,000 IU per day. Magnesium, incorporating that into your routine. Typically, I talk to patients about an evening time magnesium, because it is a calming nutrient, but it's also a keystone nutrient. If your magnesium is not right, your potassium will not get right. And a couple of other nutrients will not get right if magnesium is not right. And it's depleted in our foods that used to be magnesium rich. We farm the hell out of the land, and basically lower magnesium levels chronically is a default of, or a byproduct of that. So things like high quality multivitamin should check the boxes for some zinc and selenium needs, as well as some B vitamin needs. So a high quality multivitamin, vitamin D, magnesium, fish oils, your omega-3 to omega-6 ratios. And I don't have optimal range for that lab work, but you can get some advanced labs that look at omega-3 to omega-6 ratios and your levels of healthy fats. But taking 2 to 3 grams of EPA, DHA fish oil per day, that's a way of getting after it. Healthy fish sources, the smaller the fish, the better. And if you're trying to avoid exposure to heavy metals, then you can look at the SMASH list of fish. That's sardines, mackerel, anchovies. What's
Herring.
the other S?
Herring.
Herring. Yeah.
Oh.
Right.
Now,
it's another S.
Is it salmon? It's not salmon because it's.
I think it might be salmon. I think it might be salmon. Yeah, fresh caught. All right. So yeah, your micronutrients and your sleep and your hydration and your fiber intake and your elimination habits are critically important to your body's ability to bounce back. And then enhancing your ability to bounce back, that's where things like adaptogens, heat stress exposure, cold stress exposure, hot sauna, cryo, cold immersion, some people are even exploring hyperbaric oxygen, and there's soft pods that can be purchased and used at home. There's hard place chambers that can be utilized. There's some clinics probably around you that you might be able to look into and just walk in the door and ask some questions. But these are all ways that you can accelerate the healing process and accelerate that recovery process. Even red light therapy, companies like Juve, where it's near infrared light exposure can reduce inflammation and kind of speed up some of the recovery, especially for CrossFit related injuries. Those are opportunities. Yeah, you really got me going on a couple tangents, but
no, it's all good. No, but if I hear you right, and again, answering the question, how do you know too much? Pay attention to how you feel. How do you recover? How do you bounce back? Making sure you have your macronutrients in place, which I'm sure Kathy's doing a great job of. And then the micronutrients, I'll just get that list from you so that we can share it with everyone and make sure that if you feel like you need to either get those in the deal in your supplementation routine or up them or something like that, we can have that as a resource.
There's a triple doctor, Alex Vasquez, that has a 5-part wellness protocol, 5-part nutritional wellness protocol. And that's the starting point that I use with a majority of my patients.
Oh, is it Vasquez that works with biotics research, right?
Yes.
Yeah. He's great.
Chiropractic, naturopathic, and osteopathic doc, educator and practitioner in the functional medicine space.
Oh, that was great.
Apologize once again for geeking out there, but I enjoy the questions. And
that's what people attend these talks for, because they want to hear that kind of information.
There you go.
Well, hey, I think that was a bang up hour. And like I said, we had a lot of other things that we could have gotten to. And if you'd be gracious enough to give us another opportunity to jump on a call, maybe we could address those things. But Dr. Steps, thank you so much for sharing your time with us today. It was so great hearing your story. And then I love the acronyms that you shared with us today. I can't wait to put those out as a resource for other people. Really, really great information. Is there anything that we can do to support you? Because I know that you're transitioning to working with Dr. Lyon. Is there anything that, do you have any resources, any places that we can go to follow you? Like what is it that we can do to support you?
I think my new focus right now is jumping on board with the Institute for Muscle Centric Medicine, and I'd say learn more about muscle centric medicine and visit Dr. Gabrielle Lyon's webpage. Some content, some education opportunities will be there. If you're interested in engaging us for care, our strategy is going to be to figuring out how to supplement training groups, training professionals to layer into their strategies that they're incorporating with their clients, and figuring out ways of enhancing their ability to recover, perform, and optimize wellness. So I'd say learn more about muscle centric medicine. Visit Dr. Gabrielle Lyon's website, listen to her podcast, and listen to podcasts where she's been interviewed. It's very much aligned with everything I'm focusing on optimizing and kind of spreading further into the world here. So
Yep.
I
Love
appreciate
her
all that.
work. I've shared it before. And then, like I said, you came highly recommended, and I'm really happy for you, because it sounds like a lot of your life has been very intentional with this desire to heal people and help people. And it sounds like you're transitioning into something that you were meant to do. And I'm really happy for you. And like I
Thank
said, if
you.
you know, like, hey, if you want to bring me along, pull me into the group there, then hey, I'll be open to it, you know,
Beautiful.
no
All
doubt.
right.
Dude,
Can't
thank you
thank you
so
enough for
much,
the
Doc.
time and the opportunity. Mhm.
Really, really appreciate it. And we'll connect offline. And thank you. Thank you for being here.
Thanks to you and your members. Have a great one.